Welcome to Spotlight Documentaries, our series on young leaders and coalitions of the White House Drug-Free Communities Program. So we're here today with Gabriella Shirtcliffe. Gabriella, you are a community health advocate for the Deschutes County Health Service Prevention Team, and you co-facilitate T Communities Health Advocates and the Youth Committee of the Shared Futures Coalition. So thank you so much for your amazing work, and congratulations on your nomination for the Ben's Young Woman of the Year.
Thank you so much. I'm so excited to talk today.
So what inspired you to become a youth leader in the fight against the addiction and the drug epidemic?
In all honesty, my interest in this work started from a purely academic standpoint. So I was more interested in the general concept of youth advocacy on a number of issues. And I was especially interested on governmental and legislative participation at a very small scale. So very interested in what my local county was up to, my local city, my school board, starting from that kind of grassroots level. And from there was an opportunity with Deschutes County here in Bend, Oregon, my freshman year of high school, so quite a few years ago now, to work with their prevention team. And from there, I really started getting into public health as a whole. And so, especially with the issue of fighting addiction and the drug epidemic, young people and youth are very uniquely positioned, especially within things like tobacco cessation, because of how important it is to start prevention from a young age. So that kind of interconnection of being interested in small grassroots advocacy and legislative issues, and young people being in advocacy, I really, really got interested in what was happening with my peers, specifically with addiction and drug use.
And can you tell us more about the teen community health advocates in the youth community of the Shared Future Coalitions and what you exactly do?
For sure, yeah. So TCHA, Teen Community Health Advocates, is kind of a branch of the Shared Future Coalition, but they operate pretty independently. And they started, I guess I was one of the founding members in 2018, so my freshman year of high school, and we grew from there. And I think the best way to sum it up is honestly in our mission statement, which I helped craft. And this is the mission statement shared by TCHA and by the Shared Future Coalition. And that is that we want to empower youth to reduce substance misuse through inclusive and equitable engagement, community education, and policy. So there's a bunch of buzzwords in there, but in reality, that looks like very youth self-directed projects, mostly centered around education around substance use. So within TCHA, some of the projects that members chose to pursue were things like social media campaigns. We created and distributed nicotine cessation materials. We worked very closely with our local schools. So literally having conversations with your teachers and your principals, and eventually people like superintendents and other kind of higher ups in that hierarchy, to try and best inform their policy. And then we also did have a pretty big legislative element, at least here in our state government of Oregon, as well as within our county level. So we testified for various bills, would provide testimony and information to our local politicians and lawmakers. And those were the TCHA-based projects. And then Shared Future Coalition as a whole is much larger and has a much wider scope. And so they work on everything from problem gambling and gambling addiction to things like tobacco, marijuana, prescription drugs, and other issues. And so they do things like have workshops for parents facilitated through schools. They created a program called Upshift, which is an alternative for out-of-school suspension that provides more meaningful programming and resources for those who are suspended from school for drug-related offenses. And just in general, try and push as much as they can to the community as a whole engagement on these issues, but most importantly, engagement using best public health practices. So avoiding things like scare tactics or authoritarian messaging, and really educating the community to be equipped to face these issues.
Well, thank you so much for doing all that. And can you share
Yeah,
with us some personal stories where you felt like you had an impact on the students in your community regarding drug prevention or recovery?
of course. Yeah. So I think one of our biggest legislative successes that really stands out to me was when we were able to testify and contribute to the eventual passing just last year in 2022, of Oregon Senate Bill 587, I think was the number. And that was a bill that is now in place in Oregon, that instates tobacco retail licensing, or TRL. And that basically is a licensing procedure so that companies and stores have to register with the government, in order before they can sell tobacco or nicotine products. So in the same way that you need a license to sell alcohol, you would also need a license to sell tobacco. And that was something that was prominent within the rest of the country, but for some reason, Oregon had never really gotten the memo and caught up on that. And that gives the government and other organizations the ability to regulate these stores and keep on them, and be able to actually, provide punishments, or, kind of carrot and stick these stores into appropriate behavior, especially with dealing with selling to minors, how much they're selling, and regulating what that looks like. So that was a huge success, and it was really, really powerful and impactful to be a part of that.
And what steps do you think that students in middle school or high school can take to avoid falling prey to drugs?
Oh my gosh. I mean, I know that this is definitely overstated in the prevention and public health world, and just said over and over and over again. But it's really important to remind yourself that you are, like, 10 times out of 10 in the majority of students and in the majority of young people if you don't misuse drugs or alcohol. And so it's kind of taking that philosophy and that fact into other elements of your life. So surrounding yourself with people who have similar beliefs, being active in other parts of life so that you don't feel, like you have to turn for drugs or alcohol for entertainment or other reasons. And remembering that message of just say no obviously doesn't cut it. So you have to create a space for you and intentionally surround yourself with a network of people, family, friends, peers that can make it easy to make saying no to drugs and making healthier choices for yourself an easy choice, a choice that you don't even have to think about. And also remembering that drug use is not this terrifying, nebulous thing that is relegated to street corners and back alleys. Like, your curiosity is only natural. Drugs are unfortunately a very normal part of life for many people in your community that you will likely engage with. And it's important to satisfy that curiosity with productive conversations, education, seeking information from reliable sources, and conversations with people in your life that you trust. So it's really just that element of building a community around yourself, and also building a community for others where, making the smart choice is the easy choice.
I think that's great advice. And what are some top strategies when you talk to someone like your peers who
Hmm.
you might suspect have an issue with drugs?
Oh, this is a good one. I think the first thing to keep in mind is you have to come in with empathy, be gentle. There are 1.5 million reasons that someone could be choosing to use drugs, and you would never know their reasoning or logic or lack of reasoning or logic behind it. And so it's so, so important to come with that lens of empathy and kindness. And also remember that don't be afraid to reach out to adults that you trust. And I know that that's much, 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 much easier said than done. But 9 times out of 10, they're there to help you, and they're more often than not especially trained in these things, and will know how to, get further treatment options and kind of build you a network of ways to escape from this addiction, or this issue that other people might be having with drugs. Um, and this is kind of a personal piece of advice, but I think it's always much, much easier, in my experience, to start anonymous. So in Oregon, we have something called the Youth Line, which is a completely anonymous, either text, email, or phone call chain, where you can start getting those first steps of working toward recovery or acknowledging that you have a problem, completely anonymous and without having to be reported or get involved with, law enforcement or other, like, punitive measures, which I know can be a really, really big roadblock to, getting help that you or your friend may need. And so if that is where you need to start and that's where you're more comfortable, there's nothing wrong with that. It takes courage, it takes a lot of confidence to get to a place to face these issues, and there's nothing wrong with starting with small steps.
And previously, you had talked about being in the majority. So, how can we
Mm.
spotlight and celebrate those students who do choose to stay clean and encourage them to be leaders?
Oh yeah, great point. Um, I mean, I think it's all about creating platforms for that. So whether it be like a social media call out, in your schools, within, your sports team, something as small as your sports team or as large as like a filler commercial in the local news. I think it really does fall on local organizations, local governments who specify in this kind of public health work to create room. So being really intentional about, like you said, like celebrating and spotlighting those successes wherever possible.
And how can more students be a part of the teen community's health advocates? Is there like a process for selection?
Yeah, so TCHA is pretty locally based. We're here in Bend, Oregon. So if you're in this area, please reach out. I can give Raj my contact info if you're randomly in the middle of nowhere in Oregon. But other than that, I think if you want to start your own group like TCHA or want to get involved with this kind of prevention work, it's really important to kind of get connected with other groups nationally who are doing this kind of stuff already, because it can seem like a big task, but there is a very easy blueprint that you can follow. There are steps that you can take, resources that have already been connected. So if you want to start your own group, again, please reach out to your local health authorities, other, even like your health teacher in your school, other resources like that. There are a ton of online resources, like the Shared Future Coalition website has information. I know that obviously there's a ton of information on the SAMHSA and kind of national side as well. Yeah.
And are we doing anything different currently to step up to the
Mm.
fight of the current fentanyl crisis?
Oh, yeah. I mean, fentanyl for a lot of people just makes things a lot scarier. And it's definitely shifting the landscape from what our parents and from a lot of current like working professionals who got their degrees 10, 20 years ago. The landscape is very different from what they are used to and what they're used to dealing with. And so with fentanyl, where it kind of ups the danger level on things that were previously, um, it wasn't as incredibly dangerous to let things slide previously. Now with fentanyl, I think we have to take things a lot more seriously. And so, for example, we're taking steps to normalize the issue of fentanyl as a talking issue, but also as a real threat. So, fentanyl overdoses and, things being laced with fentanyl is not something that happens to, people who we label as drug addicts or whose whole lives revolve around their use, but it happens to very normal people too. And it's a very, unfortunately, normal part of life. And so I think just because, it's not super new, but it is a more modern issue, getting that education out there is super, super important as we take steps to fight this crisis.
And I wanted to end by asking you what your future plans in terms of college, career, and your work in drug prevention are.
Yeah, so I actually am a little removed from, I guess, being technically a youth advocate. I just finished my first year at university and I'm headed back in just a few days. And I'm actually working in, my major is chemical engineering, so a little bit different from typical PH stuff. But I'm very involved. I'm living in South Bend, Indiana now, at my school in Notre Dame in, taking the same steps that I learned in those lessons that I learned here and applying them in the future. So I don't know if it'll exactly play out for a career for me, but definitely making it a part of my relationships and a part of the story of who I am as I continue on in life.
Well, thank you so much, Gabrielle, for your work and being an inspiration to others.
Sweet. Thank you.